So the problems in the current care management have to do with the fact that there's no standardized emergency curriculum that is being taught. All the nurses and the tracheostomy nurses, physicians, they all teach it a little bit different, and there's no standardized way of doing it. The multiple chronic medications that are due around the clock, the nurses are giving them around the clock at the hospital, but this isn't realistic for a home setting for families. The NICU nurses are not expert in the discharge process. Typically, the nurses are transferring the patients to the floor, so they don't have the practice of standardizing their education and teaching the families. There is a lack of care coordination between the silos, so when the patient is inpatient and outpatient, there's not a consistent teaching across the board. So this makes parents feel unprepared when they go from the NICU to the floors or to getting discharged to outpatient settings. They've gotten so many different teachings from people, it can be confusing. And then the stakeholders within this are going to be the patients, the families, the nurses, the physicians, the clinical care coordinators, and the vendors as they're part of it, getting the equipment, and then also the hospital administration team.